Good afternoon, good evening. Thank you so very much for joining us for our first panel the Eurasia Center has hosted on COVID-19 in the South Caucasus. My name is Melinda Herring, and I'm the Deputy Director of the Eurasia Center. Today, we would like to invite you to participate in this conversation. If you're in Zoom with us, feel free to submit a question. If you're on Twitter, please use the hashtag @ACEurasia. We would love to have your questions. Now, it's my honor to turn it over to Laura Linderman, who's brought together some of the finest analysts and practitioners in Georgia, Armenia, and Azerbaijan. Thank you for joining us. Laura, it's your turn.
Thanks, Melinda. Thank you all for joining us to discuss how the Caucasus countries have responded to and are continuing to respond to COVID-19, including Georgia's success and next steps for Armenia and Azerbaijan. I'm delighted to introduce our guest speakers. We have Dr. Amiran Gamkrelidze, Director General of the National Center for Disease Control and Public Health in Georgia. Dr. Nune Bakuns, the Deputy Director General of the National Center of Disease Control and Prevention in Armenia. Ms. Arzu Geybullayeva, columnist and founder of Azerbaijan Internet Watch. And Mr. Joshua Kucera, Turkey and Caucasus editor at EurasiaNet. So to get started, Dr. Gamkrelidze, let me turn it over to you first. What differentiated Georgia's early response to COVID-19 from its South Caucasus neighbors? What specific actions by the government or Georgian society contributed to your low numbers?
Thank you very much. First of all, it's a great pleasure for us to participate in this webinar, to be together with our neighboring countries and our friends from Azerbaijan and Armenia. And you know, that's currently the situation regarding the COVID-19 in Georgia, in comparison with other countries, not only the neighboring, is more safe and more, I will say that's stable. Currently, we have 879 laboratory confirmed cases in Georgia. We have currently 161 active cases. The recovered ratio is around 80%, and unfortunately 14 deaths. Per million, the all total tests what are confirmed in Georgia are around 80,000, more than 80,000. Per million, we are doing around 22,000 PCR tests. Not, of course, estimating and calculating the rapid tests where we have more, maybe around 25,000. And currently in quarantine, which is one of the major, measure of how we are competing with the COVID is around 2,795 persons. What's the success of my country from my vision? It was the very timely and yearly rapid multi-sectoral response. I will say this in one sentence. We started the preparation to this pandemic since beginning of the, at least it was the 6th of January when the NCDC has reported to the Ministry of Health that something happens in not common in China, and we should prepare to the maybe epidemic in China and maybe in future also the pandemic. That's why we started already, of course we have in NCDC so-called the EOC, the Emergency Operational Center, and we started the activation of the Emergency Operational Center in frame of NCDC. Then was created the multi-sectoral according to the governmental decree, 28th of the January, but before was the also decree of the ministry. We have prepared, the special decree of the government. We started to prepare to get the testing. At that time was not the ready, the PCR kits, test ready kits, and we asked our very good partners from Germany, Bundeswehr Institute of Microbiology, and we get rapidly the Charité primers for the diagnostic, and end of January we started already the diagnostic with PCR. But before we did so-called the exclusion measure when we in our Lugar lab for the public health research, we are doing always the monitoring of the respiratory infection against 22 respiratory viruses, including 4 types of the coronaviruses, but not the novel, of course. Novel we started at the 30th of January. And then was, the step-by-step, the Prime Minister is chair of the task force or the coordination body in the country. And this, the meetings was happened every day. Mostly the distance meetings. And Georgia started doing mostly the restriction measures. First, we stopped the flights from China, then we stopped the flights with the Iran, then we stopped the flights with the Italy, and all, the foreigners coming to Georgia was, we started quarantining for 2 weeks. First was this for the Chinese, then first for the citizens of Iran, and then from Italy, and of course then we went to all citizens from Europe or to US. And of course in quarantine we are doing as well the investigation, particularly before the leaving of quarantine. On 13 on 14 days we are doing PCR tests for everybody. And the restriction measures, we closed the schools beginning of the March, and the kindergartens and the high schools as well. And then step by step on the 22nd of March, the government has announced the special state emergency, so-called, all the quarantines. And on the end of the March, the government went to very strong quarantine and the strong lockdown. And this quarantine and lockdown was continued until first for 1 month was announced, and then this continued more for 1 month, and this was finished on 22nd of May. It was mostly, I will say, the restrictive measures plus a big awareness campaign in the country, plus testing for specific with the symptomatic patients. We started only, the testing of only with PCR of symptomatic patients, and then we added step by step the other risk groups, like the high risk groups, and we have now the big list of the high risk groups, what we are testing regularly. The health workers, all so-called the trialers, drivers now coming to Georgia. This is quite a big list of the long list of the risk groups, and if you will have an interest, I will say later on. It means that the very strong multi-sectoral approach, where was enrolled the border, the border epidemiologists. General, we had created a special epidemiological groups going to the outbreaks, to the clusters for the investigation, and all clusters have been investigated very carefully, and all the contacts. Currently, our contacts are 1 to 6. It means for 879 multiplied to the 6 or 7 are investigated. The so-called the hotlines. Our hotline was working very hard, and all the multi-sectoral response was quite successful, and coordination between the sectors was quite good. And the decision was made very rapidly by Prime Minister, and the implementation was quite successful. And I think the secret of this success is, in one sentence, is yearly preparation. As we started preparation in middle of January, and first case was confirmed on 26th of February. But between, we have prepared quite well the health sector. We have created a special COVID clinics, special so-called the febrile clinics. We have created in febrile clinics special algorithms, the triage algorithms, and as well was designated around 40 clinics in the country for the COVID diagnostic and treatment. As well, we have introduced the so-called the outpatient triage by the special hotline and involving. Yes.
Oh, sorry.
Yes. Very shortly, yes.
Wonderful. Thank you so much, Dr. Gamkrelidze, for that really comprehensive review. It appears, you said it better than I could. Very rapid and early response with excellent coordination and scientific guidance leading the way. Seems to really Georgia seems to really have been a pioneer in their response to COVID. So thank you very much. We'll come back to you with many more questions. I'd like to turn it over to Ms. Geybullayeva, Arzu, to talk a little bit about the situation in Azerbaijan. In the past 2 weeks since the stay-at-home regime was fully lifted, Azerbaijan's numbers have only gotten worse. Could you speculate why the government lifted the stay-at-home orders when it did? And would you like to say anything more about the scene in Azerbaijan to sort of set it for our audience? Thanks.
Sure. Thank you for the question, Lara. I guess it would make sense to start with the overall picture of the indicators right now. As of yesterday, this is the official data. Unfortunately, we haven't seen the decrease in numbers. We haven't flattened the curve yet. If anything, we're seeing an increase. As of yesterday, we've had 387 new infections. In total, we've had almost 10,000 patients who've been diagnosed. Over 5,000 of them have recovered successfully. And we've had 199 deaths recorded. I would want to say that these are accurate numbers, but I cannot stand behind them. These are the indicators that are provided to us by the authorities, by the official body that's been set up to monitor all the numbers and indicators. So I will leave it at that. I think the government responded actually quite late. If we look at the response rate, especially when we compare with the measures taken in Georgia after Dr. Gamkrelidze's presentation, we've closed our borders with Iran quite late, and the measures that were put in place were quite late. As to your question about the weekend lockdowns, I think if we look at the time frame in general of response mechanism, I mean, the special quarantine regime was introduced on March 24th. This is already pretty late if you compare with other countries in the region. Then on April 27, the quarantine regime was kind of lessened, kind of relaxed. And if you compare, for instance, to Turkey, where from mid-March until almost June 1st, there was a special quarantine regime with weekend lockdowns almost every weekend. This was quite early to begin with. And so when they've when they've reduced the special quarantine regime and people started going out with cafes opening up, obviously, it was natural that the numbers are going to go up, and also people not taking measures. I've been following the news from home that people are not really being cautious, people are not wearing masks and whatnot, and social distancing isn't we come from Caucasus, social distancing isn't really a thing in our culture, right? Even in times of pandemic. But that putting aside, the decision to introduce a weekend lockdown was of course met with much of criticism among the public, mostly because people were not prepared, and also saying, well, if we're kind of relaxed the regime, why are we going back into weekend lockdown? And so there's been a lot of demand into more explanations. Obviously, this is also linked into the transparency of the reporting and to the measures in general in terms of what the government is actually capable of taking care of patients, whether there are enough hospital beds. Right now, we're seeing around 400 cases a day, which is almost on the average of the number of hospital beds that hospitals have to offer in Azerbaijan. So the criticism that's been coming from the public with regard to the weekend lockdowns has been mostly related to the overall picture, whether the indicators are actually accurate, if we had such a low if we had so low indicators, why is it that the measures are becoming harsh, and why all of a sudden we have more numbers and whatnot? And also the way the information is moving. If you have access to information, obviously there's more understanding across the public of what's going on. But when everything is limited to what you only get from government resources, which you don't really have trust necessarily, which you haven't developed trust to, then yes, that creates issues and criticism, of course.
Thank you very much. It does make sense, the sort of the lack of awareness and maybe trust in the information that is coming out. Dr. Nuniba Kuntz, I'd like to move to you next to discuss the current situation in Armenia. As we know, it is currently the most serious in the region, and I know you've been continuously trying to add hospital capacity. Could you set the scene a little bit for us, and maybe try to discuss, like Azerbaijan and Georgia, Armenia did put restrictive measures into play in March, Georgia maybe perhaps earlier, but why has the outbreak been more acute in Armenia?
Thank you. I would like to introduce briefly the situation in Armenia. Unfortunately, it is also, we are not flattened the curve yet, although we also start quite early, since starting from January, with preparation, with command center that has been created in the country, all stakeholders, ministers and departments involved in all the regions of Armenia, and it's operated since that on a permanent basis. Armenia also declared a state of emergency at 14th March. And we 2 times extended it, and now we extended it until the July 14th. Starting May 4, in Armenia, we start gradually lifting some restrictions with industries and institutions, and introducing at the same time strict requirements and rules for ensuring anti-epidemic regime. What was introduced in Armenia, what measures we used? That was the wearing of masks, social distance, hand washing and disinfection. Firstly, in organizations, shop, pharmacies, non-closed during quarantine, and started since March 14. Then complete restriction, quarantine and lockdown was introduced. Then mandatory wearing of masks in public workplaces and transport after May 4, and outdoors from May 25. Quarantine regime now is being introduced in central location and organizations closer, depending on the numbers of cases reported. What we did is do border crossing points. From the beginning of outbreaks, entry into the country from different countries was gradually prohibited. We started with China, then Iran, then European countries, and so forth, until full, complete prohibition. Additional conditions just established by government with Russian Federation, Iran, and Georgia. A return of Armenian citizens was done to the homeland. Border control was introduced from the very beginning. At ground checkpoints, trucks are allowed now to enter. All drivers are subject to control and escort by the police, and hold health workers through the route. Up to June 1, all arrivals were quarantined, and everyone was tested with PCR after 14 days period. Not just symptomatic, but all persons. But after June 1st, arrivals are just put it on self-isolation and then monitored by phone and completed on 40 days. Now we are testing only symptoms. Detection of case is done almost exclusively by PCR tests, because in our country, COVID-19 cannot be made diagnosis without positive PCR test. We also enlarge our testing, introducing new laboratories, including also private and payable. We start to testing everyone according to based on WHO case description, but we took people with more low temperature, starting on 37, not 38 and 5 as WHO, and each contact was quarantined until the 40 days period and then tested. From June 1, now we are testing only contacts with symptoms and after self-isolation. Of course, rapid tests, we are almost not using them at all. Treatment of COVID-19 is free of charge within the state budget. We open referral centers for treatment of coronavirus disease, triage of patients and distribution to the referral centers for carried out. Unlike many other countries, Armenia were hospitalizing all positive, COVID positive patients until June 1st. After June 1st, asymptomatic and mild forms of COVID are treated at home by the outpatient service. We started contact tracing activities since February and right now, by making epidemiological investigation of every case, COVID positive case. Contacts are identified not only in families but also in organizations, and we are finding them proactively. We are not waiting to symptoms, and we are not keeping us only to first point contact. We are actively going for tracing contacts, second, third, and finding positive COVID cases. Separately, activities were carried out for health facilities. Of course, we were isolating contacts. Again, until 1st June, contact persons were quarantined in specially designated place at state's expense under round-the-clock supervision of attached health workers and medical examination. Everyone, again, was tested after 40 days period, and negative test results go home, and positive, of course, hospitalized. Now, after June, yes.
Yeah, thank you. I'm going to stop you here, but we'll come back to that. Okay. I'm sure there'll be additional questions on Armenia, but I'd like to thank you for this comprehensive review of sort of the actions Armenia is taking now, how they've changed over time, and the increased testing. That's really useful to sort of dig into. I'd like to dig into maybe a political side of Armenia with Mr. Kucera and ask you a couple questions a bit more on the situation in Armenia. Prime Minister recently sacked the heads of the Army, Police, and National Security Service on June 8th, saying they had set a bad example over coronavirus restrictions. Do you think this signals a positive change in the handling of coronavirus in Armenia, or do you believe it will make matters worse? And additionally, Armenia has a reform-minded government in place, and could you comment on how they've done communicating with their citizens and how transparent they've been? And Dr. Bakuntz, if you'd like to comment on that as well. I'll turn it to Joshua first.
Thanks. So first of all, in Armenia, I think the big sort of political problem they've been having is a sort of erratic response of the government. First, they responded somewhat slowly to the initial outbreak. Their early cases were from Italy. When Georgia had closed the border to Italy, Armenia did the same thing only 9 days later. During that 9-day period, they had a number of people, 2 people, if I remember correctly, who became sort of super spreaders. And so that early response from Georgia kind of made the early difference between the Georgian and the Armenian response. Following that, there was the sense, and this is both in Armenia and in Azerbaijan, that there was a bit of a back and forth, and nobody knew exactly why the governments were doing what they were doing. And this is not to pick on Armenia and Azerbaijan. Frankly, the United States has done the same thing in most places. And I think that kind of undermines people's trust in the government, that they know what they're doing. Whereas in Georgia, I'm based here in Georgia, and there's always been this sense that if they're opening things up, then it means that they're safe to open up. And conversely, if they have closed things down, it means that, okay, then we need to be closed. I mean, here, I knew people here who very early in February were quarantined after having one came back from Asia, not even China, just Asia, another from Italy, and had only transited in Milan. And these people were put in 14-day quarantine, and we thought at the time, like, this is crazy, this is really an overreaction. But then we saw that, in fact, this was not an overreaction. And I think things like that, these early kind of firm steps by the government in Georgia, gave people confidence that they knew what they were doing. And I think in Armenia and in Azerbaijan, and frankly in much of the rest of the world, we don't really have that confidence. In terms of the sacking of the security officials, I mean, that has nothing to do with coronavirus. That was a pretext. Pashinyan himself had been photographed notoriously just a few days before that at a wedding, or not a wedding, I'm sorry, it was the inauguration of the de facto president of Nagorno-Karabakh. He was there, it was a big celebration, and no social distancing. Everyone was crowded together. And so for him to then, a few days later, really only a few days later, claim that he was doing the same thing because they had done that was a bit rich. And that, I think, feeds into the lack of trust that you see in Armenia. And this is only anecdotal. I've only been in Georgia for this whole period, but my sense is that people are here much more observant of the rules. I don't want to say people are social distancing. I think Arzu is correct that that's not such a Caucasus thing, but still people are wearing masks, and people are not complaining about not being able to do the things they want to do. And for the most part, people have accepted the situation, and I think that's due to the kind of decisive actions of the government.
Thank you. Did you have any commentary, Dr. Bakuntz? Or I'll move on to Dr. Gamkrelidze.
Yes, absolutely. Thank you very much, Mr. Joshua. That's your the vision and assessment. That's, yes, once again, I'd like to underline that's from one side, from one hand, the measures implemented by government, and from other side, the flexibility and the adherence from the society was quite, coordinated. And this was one of the, indicator why we until today have this kind of epic situation in the country. We don't know how it will be in future, because since 27th of April, we started this mitigation and process, and to be, the more relaxing these measures. Step by step, the government has elaborated six-step program. Each step took 2 weeks, and according to the epic situation was made the next step. In some, they made some steps, we made acceleration as well. And now, fast, I will say, around 75-80% of these restrictive measures are now relaxed already. And it was, the forecasted that could be some kind of small increase of each the annual numbers could be. And the last 1 week we have a 9, 12, 15, 13 new cases, but it was forecasted that during this process could be this, but it's manageable absolutely by the health sector, and the health sector is doing now well. And all this, the cases we have investigated quite carefully. Only in 11 cases now we have a problem when we are not getting the first sources. We cannot get the first source of the infection, and we are more, carefully for this and looking more for this. But generally, of course, what was mentioned now about Georgia, once again, I will underline this, the rapid and the timely and the yearly response of these restrictive measures was major, I will say, the power, yes, major power, major tool for combating the infection. Of course, with all recommendations of the WHO and CDC to take, the masks, to take, the social distancing, the individual or the public, I mean the hygiene measures, etc., everywhere in closed areas, etc. This is, of course, the obviously. As well, of course, the approach to the treatment, what the Georgians did, and when, we recovered quite a severe patients, of course, this was also for the clinicians major tool.
Thank you very
May I
much.
add something? May I comment?
Yes, sure. Go ahead.
So I would like to make some remarks about what was being said about our actions, and just remind that we introduced the state special state status and quarantine in March 14, earlier than everybody in our region, a week or 2 weeks earlier than other countries. That is first, saying about a late or early response. We were acting very actively from the very beginning, and we introduced quarantine even before March, and the travel restrictions as well. And given that we were neighboring with Iran, and Italy came much later than Iran and China, we have to say that all our measures have some success, and we did what is possible. Of course, we had some not problems, but some delays with introducing masks. But we explain it by some cultural and ethical sensitivity of Armenian people, and plus doing with the ethics and religion. And then coming to how our prime minister was acting, he was from the very beginning, the government was very active in working, and now the Pashinyan himself is leading or the first actively awareness raising and reclaiming using the masks, going live every day with messages and with some support to these all restrictive measures. The thing that was done previously as well, but maybe activated much more recently.
Thank you very much. I appreciate, no, it's a helpful context. Thank you, Dr. Bakuntz. A question from the audience, which mirrors another question that I had for Arzu, from Ambassador Richard Kozlerich. His comment is, in addition, in Azerbaijan, the authorities have been using COVID-19 to justify further suppression of human rights. And I'd like to just add to that, has there been, how has the government used the pandemic as a pretext to arrest and silence opposition activists and or government critics? And has there been public outcry about this government's handling of the pandemic? Has the harassment continued? Could you give us a little context there? Thank you.
Sure, I think that may be a topic for a whole hour-long discussion, if not more, but I'll try to keep it short and as detailed as I can. Yes, the ambassador is very much correct. There's been an intensified level of crackdown. I think that goes also in combination with changes to the national legislation, in particular to the legislation on information, informatization, and access and protection of information, whereby adding a layer of protection to the information that is being shared by the authorities, but also holding those accountable for sharing sort of unallowed information online and punishing them. We've seen an increase in detentions. We've seen an increase in arrests. We've seen an increase in intimidation. Right now, according to the Council of Europe statistics, there are over 10 journalists who are being detained. There have been several social media activists who have been accused of violating this quarantine regime, quote unquote. And mostly, if you look, not mostly, all of those posts that they've been accused of violating quarantine regime for have actually been holding the government accountable, whether asking the government to increase the number, the amount allocated to the families in need, or asking the government, in fact, demanding the government to be more transparent with the indicators, or just asking the government to take measures that are indeed answering to the demands and the needs of the people. We've seen how not only these activists have been detained and then sentenced to administrative detention ranging from 15 days to 30 days, but we've also seen how members of political parties have been targeted. We've had a case of sort of double arrest when a member of the political party is arrested, sentenced to administrative detention. As soon as he's released, he's arrested again and sentenced to additional administrative detention on different charges, one on hooliganism or petty hooliganism, or one for violating quarantine regime. We've also seen a very interesting case of digital harassment, digital crackdown, and this goes to an example of the leader of a opposition party, Popular Front, Ali Kerimli, having his internet cut off and his mobile network cut off. And this happening 15 minutes before going on live interview with a journalist based in the US. The government institutions have resigned to the mobile providers to respond, and mobile providers are saying that we don't know what's wrong, everything seems to normal, but when you look at the internet connectivity in the house, it's only their apartment that seems to not have any connectivity, whereas everyone else living in the building does have internet and mobile network. We've also been seeing how family members of activists have been harassed. I mean, we've seen how Ilkin Usman's wife has been harassed online, fake social media accounts popping here and then, impersonating activists, impersonating public figures. We've seen account hackings a lot. There's been definitely an increase in that. So there's been a sort of crackdown on all fronts, not just offline, but also online. And I think this is quite important in just seeing the extent of how government is monitoring, how much government is monitoring the criticism and the demands. Did I touch on everything?
Yeah.
I think I forgot one of the questions.
I thought it was a really helpful context to sort of highlight that online piece, because I think that that's getting overlooked a lot in what we're seeing, in the press. So really important piece. We've got a couple more questions in the audience for Dr. Gamkrelidze and then Mr. Kucera here that I'd like to ask. So sort of a twofold question. One is, the government is talking about enacting these green corridors for tourism in Georgia. And could you talk a little bit about the requirements tourists would have to meet to visit and which countries may meet the requirements? Relatedly, if there is a second wave in the coming months, do you see elections in Georgia being delayed, or how would that impact upcoming parliamentary elections in October?
Thank you. Regarding the tourism, today officially we opened the internal tourism. We started with internal tourism. I mean, the special teams from the so-called the labor inspection, together with the elaborated standards, has inspected many, the hotels, many resorts, etc., etc. And when they approved many of those for starting internal tourism. It means the Georgians, and there is a slogan now what we have, to learn more Georgia by Georgians. It means Georgia will stimulate the government local internal tourism much more. Of course, the tourism is most attractive, and Georgia is one of the most attractive countries. Last year we had around 10 million international tourists. Of course, in reality, we cannot realize the same in this year, but officially it's announced that since of the 1st July, we will open the touristic roads for, the so-called the green countries. And this will be based on the bilateral agreements. We are now looking on the decision of EU and mostly the EU countries for the third countries, what will be the politic of the EU countries for the third countries. And parallel, we are doing the bilateral negotiation with the Baltic countries, with Israel, with the Balkan countries, etc., where they are, they announced as a green countries. And based on this bilateral relation, we will introduce some, the conditions. It should be before the coming to Georgia, have some kind of COVID passport or so-called the PCR investigation or note to make this investigation on the border, etc., etc. There are prepared some protocols for this. It means that since 1st of July, officially, government has announced that we will open our border only for the green countries, so-called the green countries. And this will be based on the bilateral negotiation. Regarding the second questions, if the second wave will be happened in Georgia, then this year is politically very important year. 33rd of the October, we have the parliamentary election in Georgia, which is most important event. And always in Georgia, so-called the respiration disease season starts since 2nd of October or in November. It depends. In some years, this starts in October. In some years, mostly the influenza season. And this forecast, if in this year will be overlapping of two major infections, the corona second wave and the influenza will be more difficult situation. But if I had a press conference today and I announced that if the epic situation will be similar as we have now, and we will maintain this situation in autumn, I think no problem, will be no problem with election or with starting, the education in the schools, etc., etc. Of course, the epic situation will be much worse than what we see now in the South America or somewhere, then of course this will be additionally discussed politically between political parties, and they will then together with government decide the further steps. But current situation, what we have, there is no problem for the election.
Thank you very much. And Joshua, can you just comment additionally on if the government's, can you talk about the government's response to COVID and how that may impact electoral results in the fall, as you see it?
It's quite interesting. Right before all of this started, this was a very kind of volatile political situation here. The election, the formal campaign had not started, but there were protests and there were, it looked like moves from the government that people thought they might be trying to kind of put their thumb on the scales and keep power unfairly. Then this pandemic happened and sort of upended everything. And remarkably, the government here before this pandemic had very little public trust. There was a great deal of cynicism about this. And obviously, I think across the board, people have begun to think differently about the government. And I don't think it's changed how they think about how the government does other things. But surely that's going to help them in the election. I haven't seen any opinion polls measuring kind of party affiliation since all of this started, but I think it just absolutely stands to reason that they'll get a boost from this.
Thank you very much. Arzu, another question from the audience, which is for you. Social media rumors that Azerbaijan is out of ventilators and hospitals are full. Is there any way to get a sense of if this is true, or can you comment?
I cannot confirm or deny the rumors, unfortunately, but I could say, this is something I actually wanted to say in the beginning as well, is that, before we even talk about whether Azerbaijan was prepared or responded on time or not, I think we also need to look at whether Azerbaijan's healthcare was even equipped with responding to this pandemic. I think in Azerbaijan, average Azerbaijani does not get access to decent medical care outside of a pandemic, let alone in pandemic. So, the rumors that there are not enough hospital beds, that we are running out of ventilators, it could all be true because there is such a lack of proper and decent infrastructure when it comes to Azerbaijan's medical care. I mean, even at the start, when the borders with Iran were closed, and the groups of Azerbaijani nationals who were brought into the country and put into a 14-day quarantine, they were placed in hospitals that were in a state that you wouldn't keep a patient there had it been a normal day, not a day spent in a pandemic. Hospitals that didn't have running water in rooms, hospitals that didn't have soaps in rooms, hospitals that even provide their patients with clean bed sheets. And so, it's always really hard to talk about these issues in times of pandemic, especially because the situation is so bad in general. And I think there's one other point that needs to be made. I mean, especially in the last couple of weeks, there have been a lot of not rumors, but actual stories circulating on social media of people calling in and asking for medical assistance for patients who have high temperature, have fever, and not getting the adequate care that they should as citizens. Someone on the call would say, "Oh, well, if it's a case with fever, we can't come. You have to revert to another special like a government body that is in charge of this." And when you call them, they don't answer. And when they do, they answer too late. And when they tell you that, okay, they're going to send a doctor, the doctor comes in and all that he or she does is give an anti-fever medication. And they refuse to take patients into the hospital. I mean, a friend of mine just lost his father today because the care was not provided. I heard of other stories of families losing family members because this has been the case. So I think, rumors are not, I mean, there are actual deaths happening because of the dire state of the medical situation in the country. And I think this is one of the biggest issues right now in Azerbaijan.
Thank you so much for that helpful context, Arzu. It does really help sort of clarify, what we should be looking at and the additional factors, that around this problem. So a question for Dr. Bakuns and Dr. Gamkrelidze about Armenian-Georgia relations. So there's several aspects to this question. First of all, Dr. Gamkrelidze, we've seen that you've offered to send tests to Armenia. We'd like to hear a little bit more about where these testing kits are being made, how much they cost to make, and if they're being made in Georgia, do you have plans to export them to places other than Armenia? Additionally, we've seen some coordination from Georgia to Armenia around ventilators. On the other hand, and a question from the audience was, has COVID-19 strained the relationship between Armenia and Georgia? Because we've seen some, political messages and some difficulties there. So if you could comment on that.
Thank you. It's I'll start. There's no political, the treasure between the Armenia and Georgia. We are, the neighboring countries. We have a long history to live together, these three South Caucasian countries. And Georgia has always very good relation with Armenia, with Azerbaijan, and even, during the conflicts, what was happened after the collapse of Soviet between two countries, Georgia is always welcome to both countries, and we have always, peaceful relation politically. I am a former politician, but I am not commenting always, the political issues. No. I know that the situation here, the epic situation in Armenia or in Azerbaijan is much worse, particularly in Armenia than in Georgia. And we kindly offered to our Armenian colleagues. Last week we had a very good the tele bridges with Armenia. One was dedicated to the treatment, and second one to the epi surveillance and lab testing. Each we exchanged very good our experience, and we've got very good the information from Armenia and vice versa, and the relation is good. It was happened only once when was misunderstanding the sentence from Armenian, one of the politician, and we only, I think this was only the small misunderstanding, nothing to do with the conflict. We are always helping each other. I can say that's the last year when we had a measles outbreak in Georgia. We landed from Armenia 30,000 of vaccines. In 2 weeks, we returned these vaccines back to Armenia. We helped Armenia with hepatitis C treatment medicine, sofosbuvir 2 years ago for 4,000 patients, and we are exchanging many things to each other. I think the relation between these two countries from Georgian side is excellent, and we continue always, and nothing the pandemic or the COVID has influenced on our official or our friendship relation. We are very good friends.
Wonderful. Thank you for that comment. Dr. Bakunsa, do you have something to add?
Yes, I just should say, should confirm what was said by Dr. Gamkrelidze, because he is absolutely right. We have very good relationship as a countries, as a friends, as a colleagues. We are always in a very dynamic collaboration. We are exchanging information, view, experience, as Dr. Gamkrelidze says, and now also anything else if we want. We are helping each other with returning home our citizens during this pandemic. Georgia help us with our citizens, and we help in turn to Georgia with their citizens. So we have no problems with communicating and working together with each other. I would like to say a few words on these testing kits that are now under testing in Armenia. They are giving very good results, and we are sure that very soon we will be able to produce them, and also, of course, we will offer it to our colleagues. So collaboration is always there.
Wonderful. Joshua, could you comment if you've heard on the political side rumors of bad blood between Georgia and Armenia?
Well, yes, the doctors are being very diplomatic and very professional. I mean, but it also shouldn't be overstated. I mean, there were some moments when, Armenian government has been under quite a lot of pressure from their own population about the kind of poor handling of the pandemic. And, it's been tempting to look just to the neighbor, to Georgia. There's a sort of, you want a friendly rivalry, frenemy relationship between the two countries. And Georgia's right here. And Georgia's been this international success. Armenia is saying, we're the ones with the good government. We have this nice, friendly, reformist government. And Georgia had this, kind of, trending towards authoritarianism, Georgia Dream. Why are they doing better than us? And so I think Armenia had a few episodes when their health minister, for example, claimed that Georgia was not accurately reporting its numbers. And then, as Dr. Gamkrelidze said, it was all, everyone apologized, and it was all sort of ironed over. But I think what it mainly showed is that the Armenian government has been under pressure because of this. And I think that this has kind of reflected in the problems they've had with Georgia.
We've got another audience question for you, Joshua, which is, could you comment on any tensions between Azerbaijan and Georgia right now?
I don't think there's any, I mean, there's some unrelated tensions going on with the border dispute, but that doesn't have anything to do with the coronavirus. No.
Okay, wonderful. All right, Dr. Gamkrelidze, I'd just like to give you an opportunity. Is there something you may want to mention that we've missed that you'd like to highlight before we close out the panel?
First of all, I'd like to thank you your organization, I mean, the Atlantic Council, the Eurasia branch, for organizing this this teleconference and webinar. I think this is very useful between all these 3 South Caucasian countries during this pandemic period, to have a more close collaboration, to have more, the international collaboration, to get a support from the international society, because this COVID pandemic is not for only one country. The challenge is a challenge for globe, and we should, fight against the against this, the challenge, all, the globally. And the South Caucasus, is one of the region of globe, and we'd like very much to continue this friendship between the countries and help each other to combat this problem. And once again, thank you very much. But one I like underline, that's maybe we should also during this speak about the occupied regions, what we are doing in our occupied regions. The Georgia has 2 occupied regions, unfortunately, by Russians, the Abkhazia and Azerbaijan, and so-called the South Ossetia, former South Ossetia. And of course, we are very much challenged for this. We try to have a good, the relation in health sector, because health is always out of politics, and we'd like to help our citizens living in occupied territories, and we try this as we can, particularly with with the people living in Abkhazia and Sukhumi. That's why I think will be very good during this, the webinars, to discuss also this issue, how our citizens are on this, and how healthy they are and how they are affected by this pandemic in the occupied regions, and how adequately they are getting the health services.
Thank you very much. Well, I appreciate you bringing up the occupied territories, because that was another question that we had. So I'm glad that we got to answer that audience question. Arzu, we have a question from the audience for you and another one for Joshua. So I'll start with you, Arzu. Is there anything the Azerbaijani government has done right? They've taken some steps internationally, I understand, by hosting a summit of the Turkic Council in April, and the Non-Aligned Movement virtual summit in May, prompting a letter of praise from the World Health Organization. Could you talk about what prompted this activism and any significance that it had, and anything else on this topic?
Image. The Azerbaijani leadership pays a great deal of attention to its image, and getting praised by WHO in time of global pandemic obviously helps the government to boost more of its image at home, especially in particular at home to its own public, and especially at a time when so much criticism was raised on the ground against government policies or the lack thereof in dealing with pandemic. I think this is also why the president and his wife, who also happens to be the first vice president, donated their salaries to this coronavirus response fund that they created, which they actually haven't used, even though there are over 100 million manats there sitting, just waiting for something that they may need it for. I think instead of that, like if we look at a WHO team visit that took place on March 12th to the country, where the WHO experts worked with Tabib, which is this agency for healthcare management, together with the Ministry of Health, obviously. And they talked about the response mechanisms to the pandemic, both on institutional level, but also like how they're going to deal with cases, how they're going to deal with testing, on maintaining essential healthcare services and whatnot. And this meeting took place on March 12th. And then when we look at all the other steps taken, or the lack of steps taken, I think there's very little, there is nothing positive to say on my end about the decisions that were implemented since the start of the pandemic, or at least when Azerbaijan started recording cases and actually publicizing them, because this was also something that was very interesting to observe, as the authorities only accepted that there were cases of COVID-19 in Azerbaijan when neighboring countries started responding and reporting cases of infected patients who happen to arrive from Azerbaijan into their country, or through passing through Azerbaijan into their countries. So on my end, I will not say anything that is worth praising. And in fact, the last weekend's crackdown against citizens by riot police, this illegal storming on their homes, arresting 11 citizens for allegedly violating quarantine regime in such harsh manner that completely tarnished its image, whatever image it was trying to build inside or outside the country, and in particular outside the country, that really resonated with a lot of the international human rights watchdogs and organizations who do observe and watch what's happening in the country.
Thank you very much for that overview. Thank you, Arzu. So to finish up very briefly, the question from the audience for Joshua, and we're 2 minutes over time, so no pressure, Josh. Can you give us a little bit of a summary on macro trends? We have, in the latest edition of Foreign Affairs, Francis Fukuyama identifying 3 factors that determines how a country copes with COVID-19: state capacity, social trust, and leadership. Is this the right way to assess Georgia, Armenia, and Azerbaijan's responses? Do you have any comments or anything else you'd like to say as far as regional cooperation or trends you're seeing?
I mean, I would say, so in terms of, so it was a social trust, leadership, and what was the third? State capacity. I mean, in terms of state capacity, as what Arzu said about the medical situation in Azerbaijan is also pretty applicable to Armenia and Georgia. The public health infrastructure in these countries is very poor. And so I think that was part of the reason that Georgia correctly did what it did. It realized it didn't have the margin of error that some European countries, for example, that were a little bit looser because they had such massive ICU capacity. So all these 3 countries had poor state capacity. In terms of social trust, I don't know that there's a big difference in social trust between the 3 countries. Maybe the local people can speak more to that, but I haven't noticed particularly a great difference in social trust. Leadership, obviously, and I talked about this a little bit earlier. I think Georgia, I mean, almost paradoxically, its government didn't lead. Its government stepped back and let people like Dr. Gamkrelidze lead and let the public health people lead. And I think that was one of their, that was the essence of their good response. Whereas in Armenia, it was a very political response. And the one who's giving the briefing every day is Pashinyan himself. And the deputy prime minister has been the commandant of the quarantine regime. And so it's been a very political response. And I think that makes it more erratic, as I referred to earlier, that there's more pressure on him to maybe change things that shouldn't be changed. And Azerbaijan, similarly, I think that because the government takes this so kind of personally, as Arzu said, they have also been a little bit erratic and going back and forth and not quite sure what to do. So yeah, I think probably in these 3 cases, leadership has been the key variable.
Thank you very much, Joshua. So I'd like to end it there, and thank you all for joining us to discuss COVID-19 in the Caucasus, but especially let's join and give a very warm thank you to our panelists, Dr. Amiran Gamkrelidze, Dr. Nuneba Kuntz, Ms. Arzu Geybullayeva, and Mr. Joshua Kucera. We really appreciate the time you've taken to give this really interesting and well-rounded discussion. So thank you all.
Thank you. Thanks for having me.
Thank you. Goodbye.